Hi, I'm Dr. Kimberly Turner, and welcome to Moms, Minds, and Medicine Inside Maternal Health Research. This podcast is your trusted companion on the pregnancy journey, where we break down the latest insights, answer the real questions, and empower you to make informed decisions every step of the way. Welcome to Moms, Minds, and Medicine Inside Maternal Health Research. I'm your host, Dr. Kimberly Turner, a board-certified obstetrician and gynecologist and podcast host. And today we have a very important topic. We are going to talk about mental health, mood disorders, and depression in pregnancy. And our expert today is Dr. Leslie Bronner. So welcome to Moms, Minds, and Medicine.
Thank you for having me.
Yeah, so tell us about what psychiatry entails, what led you to be a psychiatrist, a little bit about what you're doing now in your practice.
Okay. Well, I actually has always wanted to go into medicine, but I started in public health. And so I got my doctorate in public health, and I studied nutrition and cardiovascular disease. And so when I went to medical school, I thought I was going to do maybe internal medicine or maybe cardiology. And it was when I started with psychiatry that I realized I was able to see more of the whole patient, not just the biology and the sort of treatment, but I could also look at the psychological aspects and social. And so, of course, the rest is history. I have been doing psychiatry probably for over 20 years at this point. I've worked in all aspects of psychiatry, from the state hospital, the VA medical center, outpatient, even community mental health, the emergency room, and I'm currently doing inpatient work in psychiatry.
Okay. And what state are you in?
I am in North Carolina practicing inpatient psychiatry.
Okay. I was in school in North Carolina, so I still remember a little bit about North Carolina as a nice place to live.
Yes.
So we were talking a little bit before we started the episode about the increase in diagnoses of mental health. Do you want to touch a little bit on that? Like, why does it seem that we have more diagnoses today than, say, 30 years ago?
Well, I think that things are increasing because of a lot of social issues.
Sure.
I mean, I think people don't think a lot about social context and what a lot of the stressors that people are dealing with. When I started in psychiatry, I was doing a lot more outpatient work.
Okay.
And so I would see a lot more of mild to moderate mental health issues come through among people that were pregnant or postpartum. And now that I'm doing inpatient work, I'm really seeing how significant some of these issues can be. People have more significant depression, they have suicidal ideation, they have previous suicide attempts.
I'm going to interrupt you for one moment. You said the word ideation. Let's break that down a little bit. What does that mean, suicidal ideation?
Well, it's when somebody just has thoughts that they might want to be harming themselves. Doesn't even necessarily mean that they have a plan, but they're just not doing well, and they're thinking that maybe suicide is a possibility. There's a lot of people that have had suicide attempts.
Right.
And sometimes people can become psychotic, meaning that they lose touch with reality. Right. So there's a lot of serious mental illness happening.
Wow.
And I was just wanting to tell a patient story because I had a patient a few weeks ago who gave birth to a premature baby, and the baby was in the neonatal intensive care unit.
Very stressful.
Yeah, very stressful, and she was not sleeping, and she was not taking care of herself, and she had a family history of mental illness, and so she developed bipolar disorder. They transferred her to the inpatient unit, but we were able to treat her probably in a little over a week, stabilized her, and she was able to go back and continue to support her child. And the reason I bring this up because I want people to know that mental illness is treatable. And the other thing we were able to talk to her about is risk factors and the fact that she has to care for herself before she can care for her baby.
Right. My friends and I, we use the airplane analogy. Put your oxygen mask on first before you put it on the children, because everything kind of flows down from the mother.
Yeah, and she
in
did
that
not
instance.
realize that. And when she left, she said, I know, I've got to take care of myself, because that week away from her baby was very,
Sure.
very difficult for her.
Of course. So you kind of went into my next area of interest, which is number one, what are the risk factors for developing a mental health disorder? And number two, what about pregnancy makes it a unique time?
So some of the risk factors that we think about for developing a mental illness is, and I sort of put it in buckets like biologic, sort of psychologic, and social. On the biological side, of course, there are hormonal changes. And everybody knows that when you have hormonal changes, you can be more emotional, and therefore you can be more susceptible to mental illness. If you have a personal history of a mental illness, so you have a major depressive disorder or a generalized anxiety disorder, of course you're going to have an increased risk.
Okay.
Family history,
Yes.
the genetic vulnerability, so the person themselves may not have developed a mental illness, but you're at higher risk if you have a family member that has some kind of mental illness. Then, I look on the psychological side as well. People that don't adapt well to change, people that don't have a lot of good coping strategies, they're going to be at higher risk of developing a mental illness because they're not able to manage a lot of the stressors that are going on. And then, of course, I mentioned the social side. Their social context is very important, and I think a lot of people kind of forget. If people have housing instability, if they have a lot of financial stress, if they have work pressures, if there's intimate partner violence, there's a lot of stressors out there that can impact the person's risk of developing mental illness.
Right. Right. So let's talk a little bit about diagnosis. Well, how do we diagnose some of these things, particularly in pregnancy? And then we'll get a little bit into about treatment.
Yeah. And so, the diagnosis in pregnancy is pretty similar to the diagnosis if you're not pregnant. We have to look at sort of the risk factors that people might have in terms of, are they sleeping well? Are they eating well? How is their concentration? Do they have a lot of guilt? Are they having suicidal thinking? And usually, if these symptoms are chronic and persistent and severe, this is when somebody sort of rises to the level of making a diagnosis of, let's say, major depressive disorder. So it's not sort of the just basic ups and downs that you might have with pregnancy, because there's a lot of hormones going on, there's a lot of changes happening in their environment. And so you're going to have people that can be sad, they might have bit irritable at times, they may have some problems sleeping here and there, but it's the sort of persistence of it and when it affects their functioning.
Yes.
Because when you start to see things falling through the cracks, when they're not maybe picking up the child from daycare, maybe they're not making meals like they used to. And so I want people to realize it's not just the one-off symptoms, it's when you start to see the patterns over time that we can make those diagnoses.
Right. And do you think, this is before I get to my second part about treatment, do you think that anyone in the healthcare system can make that diagnosis, or do we always need a psychiatrist?
Well, I think these days we are trying to integrate mental health into at least primary care, and probably need to do that in obstetric care. But yes, we need more people out there being able to make these diagnoses, and I think in the primary care setting they're able to do that.
Right.
And so, there are just not enough psychiatrists out there. And so if we're able to integrate into more of these spaces, I think better diagnoses could happen, particularly on the maternal health side.
Right. I know that in obstetrics we would screen, and there you can have a number from some of these screening techniques, and if the number's high, you need to refer. And then it kind of almost broke down because there weren't enough people, as you said, to take the referrals, particularly the very high scores where you think somebody might be at risk for harming themselves or their child. So,
well, there are more nurse practitioners now are taking a lot of those roles. I think we're getting a lot more providers out there that are in the mental health space, behavioral health space, that are hopefully being able to do some of those, at least mild to moderate early symptoms, and then if things get more significant or serious, like bipolar disorder or major depression with psychosis and some other kinds of
Right.
illnesses, then that's the time that you might need a psychiatrist.
Okay. So let's talk about treatment. I feel like sometimes the primary team starts a treatment. That could be the obstetrician or the primary care physician. And sometimes we prefer the psychiatrist to start a treatment. And does treatment always have to be medication?
Well, the good news is no. I mean, there are a lot of treatments out there, and non-medication treatments are abundant. I mean, I think part of it is psychotherapy, and I think people understand that there's basically what we call talk therapy,
Okay.
where a therapist can help you challenge any negative thoughts you might be having, help you manage emotional experiences, and also intervene if there are any dysfunctional behaviors.
Okay.
But there are also support groups, there's family therapy. I think sometimes we forget about faith-based supports, and sometimes people don't want to necessarily go down those roads. But if somebody says that they've been on a faith-based journey or they've done that in the past, I might suggest that they turn to their faith for support.
Sure.
The other thing is family support. One of the most important factors or mitigating factors in preventing mental illness is social support.
Okay.
And so turning to family, making sure somebody has social support is very, very important. So there are many things that we can do outside of medications.
Okay.
But there's a lot of good medications that are safe and effective out there, and not just for depression and anxiety. Of course, we have medicines for bipolar disorder. We have medicines in case somebody has any kind of psychotic illnesses. But these are the things that one would want to talk specifically with their provider to determine the risk and benefits for that particular individual.
Right.
One other thing I want to bring up, which a lot of people may not be fully familiar with, is electroconvulsive therapy, or
What's
ECT.
that? What's that?
Now, that's something, and people probably know it as shock therapy.
Okay. Okay.
But it's come a long, long way from the 1940s and 50s, and so it's
Right.
very safe and effective right now. But it
Okay.
is a medical procedure, and people have to go under anesthesia. But it's an electrical current that can stimulate the brain. And this is very important for pregnant women, particularly if they have severe depression and they cannot take medications. If we need something, more urgent treatment, so if somebody might be suicidal, they may have had a suicide attempt, they may not be eating and drinking, so this form of treatment can be very, very helpful. For
I
treating
have
patients.
not seen electroconvulsive therapy being done on pregnancy, but that's good to know that in a severe case or if there's a need, because the medications sometimes take a little while to start working.
They can take a little while to start working, and so sometimes we don't have that much time.
Exactly.
And these treatments can be more urgent for patients. So, and every institution may or may not have it, but I want people to be aware that that's a possibility.
Okay. So we talked about risk a little bit to the mother, but most times in pregnancy, people are a little reticent. They don't really want to take medications because they're afraid of what they'll do to the baby. So from your perspective in psychiatry, and you're seeing a pregnant woman, what do you tell them? You feel like they could benefit from medication. What do you tell them about the risk to the baby?
Yeah, so I sort of look at this in a place of mild, moderate, or severe disease. Because if you have mild to moderate disease, we can actually have a conversation on whether you need medications or not.
Right.
Because particularly if you've had your illness treated without medications and it's been helpful, then we can continue down that road. If you have mild to moderate disease and you're not interested in medication necessarily, I might say there's non-medication options, but we have to have a plan.
Exactly.
Because I don't want to get into the middle of a pregnancy and not know what we're going to do. The other issue is if you're dealing with more moderate or severe disease, people aren't as aware that the mental illness can have a significant effect on the baby as well.
Exactly.
And so you can have issues. Well, if you're not treating mental illness in the mother, they can have issues in terms of not caring for themselves. And so they may not be sleeping well, they may not be eating well, they may not be managing other sort of chronic diseases like diabetes, may not be going to appointments, but they can also have problems with the pregnancy themselves, so low birth weight babies, prematurity, but also in the postpartum period. I mean, we don't necessarily talk a lot about that period of time, but if a person has had a mental illness that's not treated, it can get worse.
Of course.
In the postpartum time period. This is where we start to see people with suicidal ideations and suicide attempts. If the mother is not caring for themselves, they may not be caring for the baby as well.
Right.
The first days and weeks and months is attachment and bonding.
Right.
And that is so important for just social, emotional, and cognitive development of the baby.
Right.
And, just one more thing is that the sort of leading cause of maternal mortality is mental illness. And this happens weeks to months down the road. And so suicides and overdose deaths are very, very common and important to know. So not treating disease is not necessarily an option.
Right. Yeah, I don't understand why there's still such a stigma. I think we're starting to break it
I think
around mental health. There's definitely more conversations happening.
Mm-hmm.
But people in general, if they don't want to believe that they could have something wrong with their mind, even though they can believe that there may be something wrong with their body.
Yeah. I mean, I think we still have a ways to go. I mean, mental illness is still just misunderstood.
Right.
I mean, this is a medical condition.
Exactly.
It's a brain disease.
Exactly.
Just like any other medical condition. And I think we have to continue to get that point across, continue to educate people about that. And I think integrating mental health into these other clinics, primary care, obstetrics, would allow people to see that that is the case, see people in the same buildings kind of doing the same thing. So I think that's a way to start to decrease some of that stigma.
Right. We talked a little bit about the postpartum period and the lack of sleep and the stress. Is there anything when the hormones are shifting? We really don't want to get to the point where we are recognizing these things postpartum. So let's go backwards and talk a little bit about treating even before pregnancy. How important is that?
Well, I mean, I think that is very important. I mean, I think that if we're not treating early, then we're going to encounter all of those problems that we sort of just talked about.
Right.
And I think educating women about that will help them to make the best decision possible, because I think people think if I'm not taking medicine, I'm okay.
Right.
And that is not the case.
In your work, do you do family counseling? And what is the role? You touched on support in the community and family, but what would be the role of, say, the partner or maybe a doula in recognizing these problems during pregnancy and postpartum?
Yeah, I mean, I think that's a good point, because a lot of times people in general and people that have a lot going on don't recognize things themselves.
Exactly.
And so it's the people around you that are going to be the ones that might be saying, you know what, I saw that you weren't sleeping well and it kind of has been going on for a little while. Maybe you might want to think about seeking treatment. I mean, I think the most important thing is that people in their circle are educated about what some of these risk factors are, so that they can keep in close communication with somebody so that they're aware when these things are happening. We want them to also understand it's not just a one-off, if they're not sleeping one day, if they might be irritable here and there. It's really when things start to pile up, that's when one wants to start thinking about seeking help.
Right. We talked about family and community support. What should we tell our viewers about how long to wait if they're recognizing symptoms before they, A, talk to their loved one, and B, seek treatment?
Well, I mean, I think it can be a tricky thing, but what we want to tell people is that if you're noticing something that seems to be short-lived, the person is managing. So if they're not sleeping well for one night, or they're not eating well for 1 or 2 days. You may say, these are going to be the sort of general ups and downs of a pregnancy.
Yes.
When it's something that is more severe, so you're noticing that they're not sleeping well for days and weeks, if you know that they're overwhelmed and just a lot of things are falling through the cracks and something becomes more persistent, functioning changes, that's when you want to sort of talk to your loved one about seeking help. But what I also say to people, if you just feel like something's going on,
It's okay to bring it
it's
up.
okay to bring it up. You may as
Yeah.
well bring it up than not bring it up. And so these are not sort of hard and fast rules. But if you're sort of noticing things headed in the wrong direction, that's when you should bring it up.
So we always think of pregnancy as this joyful time where everything is everything. But we know that sometimes things go wrong. And if we're sad during pregnancy, is that abnormal?
Well, I'm glad that you brought that up because I think that is a myth that is out there. I think society has kind of idealized pregnancy into
Yes.
sort of saying everybody has a joyful time when that is definitely not the case. And I think it makes sense because there's a lot of change happening during pregnancy.
sure.
On the biologic side with hormones and obviously a lot of social issues, particularly postpartum once the baby is here. And so what we know from the research is that about 1 in 5 women will develop a mental illness during pregnancy or postpartum. So it is quite common.
1 in 5, 20%. Yeah, that's very common. And I was speaking with you before we started that these things seem to have increased over the span of my lifetime, at least seeing the diagnoses in the chart. But there's still, despite that high incidence, there still appears to be this stigma. I know in my own family, I found out a lot of things about my mother's mental health when I was about 20 years old.
Okay.
Things that happened when she was pregnant with me that they didn't share with me.
Right, right.
And it was a really hard conversation with my aunts, but still something that I needed to know before I had my own children.
Right.
Right?
Yeah.
So I think storytelling, what's the impact of your family sharing these little nuggets?
Well, I think that is where we have to move to dispel a lot of these myths and try to break down a lot of this stigma. Lived experience is very, very important. And if women are able to talk about their lived experience, people will start to see the vast level of experiences that people have. And then we can normalize pregnancy again. That it's not just this joyful period, but people have all kinds of experiences.
Right.
And so I think it's a lot about talking to women.
Yes.
And, but the other thing is the mental health. There's stigma around mental illness as well. And so that is another piece of the puzzle that people have got to overcome. And I think better understanding and educating people about mental illness as well will go a long way.
Right. And we have such good advocacy for pregnant women these days. We have not only family and cousins and aunts, but we have partners and we have doulas. What types of resources should we point the support people to if they're noticing changes in the mother?
Yeah. There are a lot of resources out there, and I think part of it is just starting with providers that they already know. And they can start asking questions to those people. There is an organization called NAMI, the National Association of Mental Illness. There are chapters in every state. And so they have a lot of resources for the pregnant woman as well as any support systems that they have. There's a lot of peer support, so you can get individual, but there's just a lot of resources out there to help people. And I think that's a great place to start.
How do you feel about the online communities, not just peer-to-peer, but a lot of physicians are treating online? There's one called Talkiatry, I believe, instead of psychiatry. And sometimes I've heard patients wanting to be referred there because it's quicker.
Yes, so I think there is a place for it, but what I tell patients is that you still need to see people in person.
Okay.
You know what I'm saying? And I don't want people to sort of think that that's not an option because I think people have busy lives. It's hard to find providers, but not seeing somebody in person can be very difficult to make diagnoses, to sort of see how people are doing down the road. And so I say, if you can at least get in to see somebody at least once a month, that would be very, very helpful. So I think both are needed because, we just need to reach more people. But I think we need to make sure we don't get too far away from the in-person.
Yeah, I kind of agree with you on that because some things you notice just in the gestures and that you don't always pick up if you're just on a screen.
Yeah, yeah.
I do agree. Well, this is great. I think that we touched on so many important facets of helping women to recognize their mental health conditions, to not be afraid to talk about them, and to seek treatment when things are more than a one-off. It can be a really heavy topic, so I'm glad that you were here to demystify some of it. I believe that you also are now an author. Can you tell us a little bit about that journey? And then we'll probably wrap it up.
Okay, yes, thank you for that. I just had my first book published. It's called America's
Congratulations.
Health. The community is now the patient. And there was a couple of reasons why I even wanted to write this book. One is that we're just in a health crisis in
Yes.
general. We're spending trillions of dollars on health care, and we're falling behind in some of the most important population health issues, such as maternal mortality, infant mortality, and life expectancy. But the other issue is just in my inpatient work. You know, I can treat people when they're on the inpatient unit, and I can stabilize them, I discharge them, and I can see them back in 3 to 6 months' time, maybe in the emergency department, or they're rehospitalized because of their social situations. I mean, unfortunately, I have to send a lot of people out to a shelter. A lot of people have burned a lot of bridges in their lives, so they don't have a lot of social support. And so my mission for this book was to change the narrative about health in this country, moving away from treating disease and to prevention. I mean, I think what we know from research is the biggest impact on our health are the social determinants of health. And those are the factors that we've kind of touched on. You know, if you have the housing instability, financial stress, et cetera, those are going to be the things that are going to lead to health. So when I have my subtitle of saying the community is now the patient, community, if we have healthy communities, I think that's where we need to start to make a difference or a dent in some of these issues.
Okay. Well, I know that I've said before on this podcast, I feel like pregnancy is such a unique time. Women are really invested not only in their health, but in the health of their children. So if you had one last final thought or an impact statement for pregnant women about their mental health, what would that be?
Well, I would say a couple of things maybe, if I can. I would say that if you're having emotional struggles during pregnancy, it makes sense. There's a lot of changes. You're not alone. And the most important thing is if you're struggling, that should signal to you not about a weakness, but just the fact that you need to seek treatment. And we've talked about there's a lot of good treatments out there.
Excellent.
And so I think that would be one of the top things that I would let women know.
Okay.
Some of the other things that I also talk to people about is sleep.
Yes.
And sleep is one of the most important risk factors for the development of mental illness. And I know that sleep can be very difficult during pregnancy, but if you notice that there are sleep issues, that is something that you need to address. The other thing that I talk to people about is social support, because social support is one of the most important mitigating factors in the development of mental illness. So if you don't have your support system around you, that is another place that somebody needs to look. And I think finally we have to really focus on their social context. What is going on in their lives? Because, you know, maternal mental health is shaped by what is happening in their day-to-day lives. And that is not just about their social circumstances. Those are really actually risk factors for the development of the illness. And so we also have, if we can sort of create environments where women can thrive and do well, then that can improve outcomes for them as well as for their babies and for their families.
Right. Well, thank you. That's what we're trying to do here on Moms, Minds, and Medicines. Educate and demystify some of these medical conditions. So we just thank you so much for your expertise and your presence here today.
Thank you for having me. I always love to talk about mental health.